There. Can you hear me now?
Hello, how are you?
Now it's working. Thank you. How you doing?
Okay, good.
This is my first time ever doing this, and my stubborn manhood person would not allow my wife to help me. She does this all the time through StreamYard.
You're
So
talking about streaming on this StreamYard.
right, and she does it
Oh,
every week for her show.
oh,
So, it, so,
wonderful.
so if she's at her business meeting now, she's catching this. She's probably like, "Why did he just ask me to help him?"
Mm,
But this is
That's
my
great.
first. So anyway, I figured it out. How you doing today, Dr. Sherman? Glad to have you on.
Excellent.
That's good.
Excellent.
Uh, my attempts, to be honest with you, and my audience that I'm gonna share this with later. Um, I attempted last week through YouTube and other platforms, could not get it to work. So now we are together. I have my first guest in over 2 years, just before COVID. So you're super special. And I put a quote up there in the topic: "Words, of course, the most powerful drug used by mankind," by Rudyard Kipling. I love including quotes whenever possible. And this is a topic close to my heart because I had some healthcare issues last year. And to have you come on board and just be your natural self and share with those who's going to receive it, either now through Facebook, because I'm feeding it off through Facebook, or elsewhere. This is our time, for your time to again to impact the lives of other people in ways that I cannot. But my limited story of what I went through, finding the good doctors and the proper health care and being heard and getting away from years and years of suffering with kidney stones to now having a a better diet because of the care I received and regular checkups.
It's wonderful to hear.
So now back to you. You're the expert in this area for helping people. So I built this whole topic around that. How do we get heard? Because so many people are afraid to speak to the physicians. They're like I am from that generation of the 70s and 80s. They tell us to do something, we do it, and that's about it. So
Mhm.
anyway, I'm gonna shut up.
Okay, can I ask? So we're not live yet, right?
Yes, we are. We
Oh,
natural, uncut, live. Do what you do.
okay, great. Wonderful.
Yeah,
Wonderful.
I'm streaming it through Facebook for the first time. I will see how that looks on the other side. I don't want to deviate from this to see how it looks on the other side yet, but it will be saved, and I will send you a link to it for your platforms.
Thank you.
You're welcome.
Well, so wonderful to meet you. And I'm glad that the forces of the site brought us together. And, sometimes when I look for opportunities to connect with people and to share my message, you sort of go with my gut because I'm not always looking for people with pure healthcare backgrounds, but I'm looking for, everyday people of all from all over the country and doing all different kinds of things because what I've learned through my career and my own health journey is that we are all patients, whether we see a doctor once a year or once a month. We are all patients. And in a way, it's unfortunate the name everyone, I mean, we're all people. It's
Mm-hmm.
unfortunate the word patient is the word because people so much want to pull back from, I'm not a patient,
Mm-hmm.
because people are so afraid of finding out that there really is something wrong with them.
Mm-hmm.
And that was my story too. So when I figured out, putting together my career in healthcare administration with my really complex journey with my chronic diagnosis, which ended in a stem cell transplant.
Wow.
I putting all that together, I really felt, well, I think I have something to share. Um, and so that's why really I contacted you to just be able to share that message. It's it's been quite a journey having a career for over 35 years and then suddenly your health crashes and you can't work in the
Mm.
same capacity that you used to work.
Mm-hmm.
But I am happy to be here because it will on June 6th, it will be my 6th year anniversary of my stem cell transplant.
Wow.
I'm a
Wow.
be a 6-year survivor.
Wow.
And every day, I remember that
Wow.
because I just want to be, and I feel so grateful that I had the opportunity to have good doctors who really followed through on a process to get me the care, the treatment that I needed. And I was not doing well when my health crashed. And I just had great support, both medically and at home, my family, my husband, my children, just wonderful support system. Not everybody has all that. So I do feel very grateful that I had that kind of support. But then again, I did come into the situation with a lot of knowledge about how the healthcare system works. So not how the clinical systems work. I have nothing clinical in my background
Right.
except my own illness. I
Mhm.
am really, I knew when I went to college that I wanted to go into the healthcare administration field because my father was in a similar field. And so I was very directed all through college that I knew I needed to go to graduate school for healthcare administration to continue on that path to do what I really felt like that I was called to do. Now, when I say that, it is so strange to me because really as a 16-year-old, 17-year-old, what do you really know about what your life could be like working in that field? I mean, it's
Mm.
amazing to me how people make those decisions so early in life. But when you have, a parent or a mentor, somebody you look up to that has had not just a successful career, but loves going to work every day. And that was my father. He loved going to work every day. He worked at one of the first not for profit health insurance companies in the country.
Mm.
And he worked there really while he had a part time job during college to help pay for college. And then when he graduated, he got a job and he rose through the ranks. And so he did many different things at his job. But what I saw on a day-to-day basis was a man who not only really cared about his employees, but also cared about the service, the health insurance service, to make health insurance premiums lower and to sort of participate in this world of health insurance coverage. And he loved what he did. And I saw that. And I knew I didn't want to go into health insurance per se. I wanted to really focus more on hospitals and healthcare delivery. But I saw what it was like for every day to wake up, someone to wake up and just be, energized by their daily contribution to society. And I just really had that in my heart of hearts. And I don't think I've expressed it that way before and to anybody, because I do look back and say, oh, I was only a teenager. What did I know? But
Mhm.
I have had, over 40 years in
Wow.
healthcare, and I still get excited and interested to learn new things, to help people, to help myself, to help my family members, because healthcare is complex and every human being is unique.
Mhm.
And when I was in my 40s, I was finally diagnosed because I had a blood clot and they had to figure out what this blood clot was.
Mhm.
And when I was diagnosed and I asked my doctor, well, where am I? I have this disease, and I'll talk more about it, but it's a genetic disease. It's a blood cancer. And I asked the doctor, well, where am I in the spectrum? Do I
Mhm.
have am I low or medium or high? How intense is my disease? And there's no grading system for this disease.
Mhm.
And he said, well, you're about medium. You would be low, but you had a blood clot, and that's a symptom of the disease. So, okay, but every patient is different. If you've met one person with the disease, you've met one person. So we have
Wow.
to handle everybody individually, and we have to monitor people, and you have to let us know. You have to keep sharing your story on what's going on with your body, how you're feeling. And it was really, was probably a good like 10, 12 years from the time I was diagnosed to the time that my health crashed and I needed a
Mm.
stem cell transplant.
Mm. So I've heard from other people about stem cells, stem cell research. Would you, how about sharing for those who will catch it later that may be facing a similar challenge? some of the things you did to overcome those challenges?
Well, as I started to talk about, I was, a healthcare administrator, but I really wasn't a patient with a
Mm.
chronic disease for many years. And
Mm.
any little symptom I had, I just ignored because I didn't think it was so bad. I had kids to raise, I had a full-time job. I had like a lot going on in my life. So I
So
ignored symptoms.
so
So
was it more the other people than yourself, what you're saying? Everybody else but me. Is that what I'm hearing?
well, part is I think being in the healthcare system and also, having a family history of many diseases, I just didn't wanna know that there was something really wrong with me.
Mhm.
I know I didn't, and my symptoms weren't that bad until they were.
Mm.
So, I was
Mhm.
able to not and so one thing, I share with people, like, what I did wrong. Being a healthcare administrator and being in the middle of everything, what I did wrong, looking back, what I should do better was that I didn't have a regular primary care physician to
Mhm.
talk to and to share things with. I my and this is true for a lot of women that their, obstetrics gynecology physician
Mhm.
is their main physician that they go to. And that was
Mhm.
for me because when I started having children, I was seeing, an OBGYN more often. And I didn't really have a primary care physician until I was diagnosed with this disease. And when I was diagnosed actually by a gastroenterologist because I was
Mm.
having pains in my stomach. That was
Mm.
the blood clot, but I didn't know it was. He
Mhm.
said, "Let me send you for some testing." I got some testing and he said, "Do you have a hematologist?" And I said, "Why would I have a hematologist? What do I have? I don't know." And he said, "Okay, you need to go straight to the emergency room." And
Wow.
that's what I had to do. And that's when I was diagnosed that I had this, a blood disorder. It's
Mhm.
called a myeloproliferative neoplasm. And at
Mm.
first it starts out with there's too much blood in your system. And then over the years, they call it the spend down phase. Then you have too little blood in your system. So your bone
Mhm.
marrow gets dried up. You have too little red, white platelets in your
Mm.
system. And so I was able to live many years very productively and comfortably with my disease,
Mhm.
except when I couldn't,
Mm.
except when my health crashed and I got very sick and I was on some bridge chemotherapy until the doctors figured out I would be a candidate for a stem cell transplant. And then they were
Mhm.
able to find a donor, a matching donor for me. But back to so I didn't have a primary care physician. I ignored my own symptoms. I didn't do any research on might have been. And I really didn't have any genetic testing. Now, back then, 20 years ago, there wasn't as much robustness to the genetic testing that there is now, but that's on my recommendation list now to
Okay.
understand your risks of are you at higher risk than the general population for getting a certain disease? And they don't have genetic tests for every single disease, but for
Mhm.
all that they have, I sort of share that I think that it's important to understand what your personal risks are,
Mhm.
genetic, family background, all that kind of stuff, because it's not really a part of a normal conversation with a doctor
Mhm.
because you're usually there for an annual visit, you're there for a particular issue that's arisen, but really for a more holistic look, what should I focus on to monitor? What should I look out for? What should I be aware of? So that's sort of another thing that I could have it'll look back that I could have done better as well. But I would so primary care physician,
Mhm.
genetic testing, don't ignore symptoms, and
Mhm.
certainly today, and doing research because today there's so much information available on the internet.
Mhm.
And I know people. It is all over the place, but there are certain trusted sources that you
Mhm.
can go to get more information and for you to improve your own understanding of certain diseases you might be worried about. Diabetes runs in my family, heart conditions run in my family, high cholesterol runs in my family. What kinds of things should I be doing on a preventive basis to have me have a healthier life and to be able to find doctors who can support my journey for, a healthier life?
Yeah. This is just it's with the disclaimer that goes with all my podcasts. This is my personal part. Where with the current political climate, I now subscribe to the American Medical Association YouTube channel, so I can get updates when I want to log on to YouTube to see what's happening there. Not so much for myself, but in general knowledge to make sure I'm getting some information from doctors. And that's a YouTube channel I strongly suggest that some individuals who may not subscribe to, because YouTube sometimes for the fun stuff, but not so serious stuff, according to who your group is or your circle is. But that's the place I personally suggest to go because I've chosen it. So as well as what you shared, relocating to Cary, North Carolina, I lost my primary care physician. Actually, I was part of a urgent care family practice, so I never saw my primary care physician was assigned to me for the entire time there. However, moving here to Cary, becoming part of UNC healthcare system, UNC Chapel Hill, the college that system, I was able to get a primary care physician like you suggested, whom I've actually seen. I have an appointment coming up with now. So that point hit home to me personally, because it's great to see the PA, it's great to see the nurse practitioner, but to have that one individual there after my kidney stone ordeal, which I was in denial about, I locked into what you said because I remember that was one of the things I had randomly growing up. We didn't fully understand what the value of it was. So I'm glad you drove that point home. Um, and just for my listeners in general, take to heart everything she has shared with you. I say that because especially in my community, the African American community, we are doing better as Black men, but we're not where we could be, and certain things are not available in certain areas depending on where you live at. I know definitely in the rural South where I came from. Uh, so if you can get to resources, get to them, like she suggested. Don't go into if you're in denial, fight the denial, because like she said, she ended up in the emergency room. My wife took me to the emergency room, and I was in denial for 6 weeks, so I was bleeding. I was bleeding profusely, and I didn't want to admit it. So there we sat for 6 hours to get rushed into a surgery, to have a second surgery. I wanted Dr. Sherman up here because not only because of her information and my research on her bio and information she's sharing her bio, because I'm less than 15 months out from being that person she talked about. Under that care every so many weeks, getting checked up on drugs, medication, all of that, simply because I allowed denial to take over. Now, this is a part I will share for numerous guests because tomorrow I have a hypnotist and another clinical social worker on tomorrow. So for whatever reason, this is a week to dive into personal wellness, personal health care out of the gate Monday and Tuesday. It's and there's you people have seen me before, heard me before. No, I try to be very unscripted, just enough information so my guest can do what she just did, tug at her heart. Dr. Sherman is tugging at my heart now. And in her information, the Thinking Patient LLC is a company. The website links are there. Please visit her site, use what she has available, reach out to her if you see a need to. It's definitely a challenge for some people to talk to their physicians. It's definitely a challenge to be open and transparent. She could have came on Life is About More Than Living. I mean, totally technical, but the lifeblood of this podcast is personal. There's one individual who showed our view in July said, keep it human to human. Now, going back to more of the human side, to getting your doctor or your physicians or team of physicians or however your medical care team looks to really hear you, what would you suggest if you're uncomfortable sharing? How do you go from being uncomfortable to finding a level of comfortability to ensure that you get the care you need?
I love this question because we need to sort of coexist in two states. One is the state of fear and denial. And I love your thing. I'm going to use it, fight the denial. You have to try to fight the denial and you're all balled up all the time, but yet you need sort of an objective pathway to follow so you can do the best for yourself and really work in partnership with your doctor. So what I have this 5-step framework that people can use and think about as they organize themselves to have these conversations with their doctors. It's very important to be prepared for every appointment. So preparation is like the first step because the appointments are 15 to 20 minutes. Maybe the annual appointment's a little bit longer, but you want to come to your doctor with what your priorities are, a short version of your medical history, what you want to accomplish during this visit, what your questions are. You may not be able to cover everything, but your doctor will know you're prepared. And when you have things written down, then you can be in the discussion. As that new things come up, you can then be alert to it because you know you've already covered the things that you are most concerned about walking through the door. So that's number one. Number two is the language of who you are and your disease, what you're experiencing to be able to express that, but also to really understand your diagnosis, be able to pronounce it, know what it is, your medications, and being able to talk about their medications. And it really has nothing to do with educational level. If there is a desire to really participate in your health, you learn these things. You put yourself forward. You have the courage to put yourself forward to learn these things. And the third step is questions. Very important to put together a set of questions that you might have for the doctor because other questions are going to come up. But even more important, take down the answers that the doctor tells you, put it in a written form. Very important. Fourth would be participating. You have this limited time opportunity. So does the doctor. It's interesting to think that you're just as stressed. You know the appointment's going to be short, and the doctor knows he's under pressure. He or she is under pressure to finish this appointment in a certain amount of time. So both under this pressure, you want the most productive kind of conversation to happen. So by understanding how a medical visit goes, and by being prepared and all these things that you're actively participating, you're showing the doctor what you know from what you don't know. You're able to ask additional questions and, again, preparing those questions in advance or what research that you've done. So that's the participation part. And the fifth part I have is courage. Doesn't come easy to a lot of people. I wasn't courageous. I developed this framework after I started getting better and thought to myself, well, what am I going to do with all this newfound knowledge? And it is interesting to me. Nobody teaches you how to communicate with doctors. People are so afraid of doctors. And some doctors have sort of better bedside manner or better sort of interactive personalities than other doctors. But you are the patient. You have to be prepared. You have to be courageous. So it's about taking small steps, like the kind of things that I've described, taking those small steps to be able to then develop, oh, I can do this. Oh, that appointment went well. I was prepared. I had this question. I got it answered. I asked the doctor, look, I have a lot of other questions. I know we have a short appointment. How can I communicate with you in between appointments? Every doctor has their own methods. My hematologist allows me to text her anytime, day or night, even when she's on vacation. And I can't believe she does that. But I think it's just a wonderful showing of commitment to her patients, knowing how difficult the disease can be. But some doctors say, put your question through the portal. Some say, call my office. Some say, here's my email. But you should know. And, for you, Alfred, with your new primary care team, find out how they best like to communicate with you.
Yeah,
and then
now,
you can ask questions when you have those questions.
Yeah, in that particular area, and I need to praise her more in her presence than I do always online. That's my wife reminding me that. So, because I'm going to go there with this, what you just said in this area. Uh, she has supported me no longer working for a regular employer. So I do a side business, which I'm not going to tell about, that allows me to connect with a lot of people, which pays some. And long story short, though, is it checks back to my last visit with my primary care physician, Dr. Spissick. I have the hardest time in the world pronouncing her name. Anyway, who understood the change I was about to make as far as employment goes, changing insurance coverage and things of that sort that happens with a major change. And one of the last things she said to me, and thankfully I've not had to use it, she told me if any time, regardless of my current situation in life, I need her, send her a direct message through our portal, and she will get back to me, regardless of what's happening around me, to make sure I'm still on track with the things we discussed. Because if something happens and throws my body out of a certain rhythm, she let me know, reach out to me regardless, and I will give you a response. Not just a virtual visit, I will send you a message. And then if I need to see you, you can take the next step to get in and see me based on my response back to you. I'm like, wow, 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 wow. Because, like you said, different doctors, different patient to doctor relationships. But to have a physician like that with all that's going on, and it's their job to take it personally, because I've been seeing her for about a year now, to say, reach out to me regardless. That hit home. I haven't had to do it. Thankfully, I'm on track for my regular appointment coming up, but she's been available. Like you say, your hematologist. If you can find someone like that, I don't have words for that.
Absolutely. What a wonderful thing. It just, not everybody is fortunate. Some areas of the country, it's difficult to find primary care physicians.
Hmm.
There's a shortage of primary care
Hmm.
physicians. There's a shortage of physicians who are known as geriatricians who treat
Hmm.
people over 65 years old.
Hmm.
It's a real need because as we age, um, diseases have different symptoms and look differently, and pharmaceuticals are different. And so to have a physician who's that skilled at understanding the aging process coupled with different disease categories, it's just amazing. But not everybody is fortunate enough to be able to find one because there's a
Well,
shortage.
let's follow up on what you just said about the aging part. Because myself, I'm 62 right now. Okay. And this will be sent out. I chose Facebook in particular because I have over 1,500 followers on Facebook. I'm still building the YouTube and Instagram. And of my follower list, there's a large number of people. I'll say a large number. How can I? Maybe I'm wrong. There's quite a few people. I haven't measured the numbers, the demographics. There's quite a few people in that age bracket, and I never thought about changing physicians based off your age. Let's dive into that a little bit. Why that's more important? You touched upon it, but why is that really important to communicating with someone that's more in tune with the age you according to your age bracket?
Well, as I'm sure many of you viewers know, that to become a doctor, you go to medical school.
Mm-hmm.
And then after medical school, you do a residency. And the
Mm-hmm.
residency is usually in the specialty, in the area that you want to specialize in. So
Mm-hmm.
you get general training in a residency program, but then you get to pick a specialty. And maybe in the last like 20 years or so, there have been strengthening of the residencies for geriatric physicians, but it's not that sort of selected as a specialty as other specialties are, like cardiology
Mm-hmm.
or dermatology or
Mm-hmm.
gastroenterology or neurology. This is a specialty that really only, I think, a certain percentage of medical students are interested in. So that in a residency for geriatric training, there's additional education, there's additional experience, there's diving into, research, and it's the application of that research into clinical practice that gives these doctors who are trained in geriatric medicine that really a very significant layer of added knowledge about what the aging process is like and how diseases affect the aging process. If many internal medicine doctors work across age categories, and some who have been in practice a while, maybe have accumulated more geriatric patients, meaning more people over 65. But geriatricians will see people who have certain chronic diseases, who, let's say, the disease causes an accelerated aging process, when someone could be in their 50s even. So it's very person specific, but generally 65 is the marker for, if you have an opportunity to, like, if you like somebody at 62 and you feel like you're being taken care of, in a comprehensive and a way that's good for you, then maybe the next time you have to select somebody in a few years, that you would look for a geriatric doctor.
Okay. And that's one thing, as far as the healthcare team I've been associated with, they have no problem making recommendations to other physicians. At first, I'm like, yeah, you trying to get more money out of me. But really, the people that they recommended, especially regarding kidney stone issues and things of that sort, they've been right on point. I try to keep my episode, either book a large window. I try to keep them within 30 to 45 minutes. That which will give me time to download and upload. And I'm not trying to take anything away from this conversation, but I put that out as a reminder that yes, we booked this window, but we can also be like in this window time. Now, that being said, I'm gonna flip the game back over to the conversation back over to the opposite in the age spectrum. As a grandparent, which grandparents, depending on their interactions, have different, their voices are heard differently when it comes to their grandkids. So, what would you say to the parents that are out there now with what I call the little people who cannot really speak for themselves? And I know when my kids were small, my heart would get wrapped up in their doctor visit. And it's not always, I'm not always thinking, because the emotion is there, it's your child. Or even parents with adult children in certain situations they have to be caring for. What would you say to parents as far as speaking in a way to get better care for their kids or perhaps grandkids, and they speak to their children on behalf of their grandkids?
I think some of the things that we've talked about also apply to raising your children and taking care of your children. Certainly, parents that are more sort of organized and treat having routine care and specific doctors for your children, that it ends up working better. I mean, the whole notion of prevention and monitoring and doing all that sort of medical science allows is very important to support, a healthy life from the very beginning. So selecting the right doctor, depending on where you live, it may be more difficult, because pediatrics is one of those specialties also that there aren't as many doctors who choose pediatrics as
Yeah,
a
excuse me one
specialty.
second. That was kind of what I was also wondering. Why is that, in your opinion?
Um,
Just
all
in your
right,
opinion.
Yeah, look, all the specialties are tough in their own way, but,
Okay.
some doctors may feel like there's, that they don't like sort of family medicine or internal
Okay.
medicine. They wanna really more specialize. It's more interesting for
Okay.
them. They wanna specialize, or there's more money, or they don't really like, they like more of the transactional kinda care that you get maybe in neurology or oncology or something more transactional than building relationships for a healthy helping your patients have a healthy life and having conversations and being really part of sort of the fabric of growing a life and having this life be healthy. So it's personal choice why people don't choose these sort of low supply physician groups. Um, and I'm sure you could probably find, 10 to 20 reasons why medical students don't select pediatrics.
Okay.
But yeah, it is a problem. I mean, I think with my children, I went through about 4 pediatricians
Wow.
because one just got tired of it and sold the practice to another
Mm.
doctor. I went to that other doctor. Oh, when I moved, I wanted to get a pediatrician who was closer. So I moved when they were young. And so about 4 different, pediatric
Mhm.
doctors. It's not the same. I remember when I was growing up in the '50s, late '50s,
Mhm.
'60s, I had one pediatrician the entire time till I was like 17 years old, and he
Wow.
worked out of his house. And that was my doctor.
Wow.
And my for my brother and sister, that was our family, not the family doctor, that was the pediatrician. And now, living in a suburb outside of a big city, you do have a lot of choices depending on
Mhm.
where you want to travel. But again, I mean, I never thought about it. I had 4 different doctors and then all the different specialists that my kids needed over the years, and I felt like I was getting good service. But I think that it's the same kind of concept applies. You don't want your kid ever to be sick, and your kid sometimes won't express to you whether they're so young. I
Mhm.
mean, maybe if they're a baby, then they'll be crying, something's wrong. But a lot of kids won't, I'm just not feeling well or what's going on or whatever, unless it's, something really like a crisis. How do you really know what's going on in their head? So you have to be the best advocate you can for your children. So the same thing applies, preparing for this visit, making sure what are your questions about how your child is going to be monitored. How does my child, what is my child at risk for? What should I be looking for? What kinds of treatments or vaccinations or protocols, or my husband and I have these kinds of diseases. What's the chances of my kids having them? What should I be looking for? And so the parent really actively being focused and organized, and despite the fear and the denial, being focused and organized. I mean, it's your decision to have a child and take care of that child. And I am proud to say both of my sons are in their 30s and they're independent, and they have learned a lot, probably more because since I got, my health crashed and I had to go through this recovery process, they've learned a lot about, oh, I better go see that dermatologist here to get that skin check.
Yeah.
I better, maybe I should, make sure I have an annual visit. They weren't having, you in their 20s, they do what they want to do. Oh, did you see your doctor? No, no. I mean, years go by. I know people even my age that, oh, there's nothing wrong with them. They don't see it. They don't have a primary care visit. They don't have an annual visit. So if you don't have a job that requires you to have an annual visit, or you're just not interested, or you think I'm fine, I'm fine. The worst time to get healthcare is when you're in crisis. The best time is to get hooked up with the system, with doctors and with hospitals, and understanding where all your healthcare is in the communities in which you live, and understanding where you can get care, and understanding what you have to do on a preventive basis. This is how you lead your best life possible, and understanding that I don't know anybody really wants to do all this. I still don't like seeing doctors, but it's so important for my health, and I want to be the healthiest I could be, and I want to be here. So I have put, methods in place to make it easier for me. Oh, I need to do this, this, and this. Okay, I come to the doctor. You come to the doctor. So whether it's a pediatrician or, as an adult, you're seeing a doctor, when you come to the doctor, prepared and organized and asking questions, the doctors really enthusiastically respond. Oh, I got a patient that's really engaged. I have a patient who wants to work with me. Oh, I have, it's very satisfying for a doctor to feel like I'm working with this patient together and I'm making recommendations and they're complying with the recommendations and they're doing it and they're feeling better. What better gift for a doctor than I'm doing good work in this world?
Mm-hmm. Well, that being said, I think we're going to finish this off on a high note because you touched upon the actual theme of life is about more than living. You want to live the best life. And engaging with your physician, your team, if you have a team of healthcare providers, for yourself, your family, your kids. I'm going to just leave it at the things you just shared. I'm not going to try to summarize it anymore. You hit a lot of bullet points for a lot of people. Hit a lot of things for me. Because this is really a form of therapy as well. I don't know how other podcasters view their shows. I see podcasting as a therapeutic for myself. And in so many ways, but this is not about me today. This is about you and what you came up here, taking time out of your day to share with the audience here. And as I get better and more familiar with the technology, and maybe I'm being too transparent, but so what? It is what it is. I jumped from audio only to video. And that's it. Thank you, Dr. Sherman. Final thoughts, and I'm going to end this live stream on your final with a brief comment, and that's going to be it. And the final thoughts you'd like to share with us.
Well, just as much as I would like to be a doctor, I'm not a doctor.
Well, I call you Dr. Sherman because it flows better with my words.
That's wonderful.
So
that's
clear. Thank you. Yeah.
That's wonderful. I think everyone has so much potential, and not everybody, does things the same way, but you find your own way, you find your own voice, and you want to participate. You want to be really very engaged in your own care for your own health. And that's my main message to share.
Thank you. And she definitely cleared. I use the word doctor a lot in here because in my world, yes, we have to physically licensed doctors, but you also have the ones who are serving as mental health, spiritual health, emotional health providers. To play off an old text, it says, physician heal thyself. All physicians don't have to wear a title. Like all superheroes don't wear capes. So we got some good medicine here from Dana Sherman today, I think. Some good advice. The Thinking Patient LLC, www.thethinkingpatient.com. If you're not endeavoring to make your life about more than living, then let today be the day you begin to make your life about more than living. Like, share, follow, subscribe, and make sure other people in your world get to hear what was shared here today. Thank you, Dana. Thank you for coming on board. And we're out of here, y'all. Appreciate you. Bye. Closing up the screen.